This patient came to us about 2 weeks back with a swelling in the left side of the neck, in the angle of the mandible, and it was about 4 into 5 centimeters in size initially, and at that point of time it was investigated, and possibility of an abscess and a possibility of secondary lymph nodes was made, and also the possibility of a parotid tumor was kept initially. However, on further examination, one of the findings which suggested that it's unlikely to be parotid because the pinna of the ear was not raised and the swelling was confined to the lower angle of the mandible on the left side, and presently this patient has this swelling which is gradually increasing in size. Local temperature is raised and it's mildly tender, and the size has increased markedly to around more than 12 centimeter into 10 centimeters from the initial 4 to 5 centimeters. And this swelling is getting enlarged and it's causing difficulty in opening the mouth. So now we are examining him again to find out what is the cause. So as you can see that this swelling is located in the on the left side, just below the ear and at the angle of the mandible, and going up to the supraclavicular region in the neck. Laterally, it is almost midway between the back and the front, and it's also going medially towards the center of the front of the neck. The margins are not well defined, and the skin is peeled off, and there are areas of inflammation, and the skin changes are present extending towards the lateral side, and on examination the local temperature is raised and it is tender and there is fluctuation. So this is an abscess, and however deep to the abscess there are solid lesions which is extending right up to the mandible. So this is not only a cystic lesion, but it is cystic and solid, and it is firm in consistency. The skin can be pinched forward, so it is deep to the skin, and it is not fixed to the muscle as it is mobile. So the swelling is now just between the skin and the muscles, and it is located in this area. So we have to think of the possibilities. So the first possibility in this area is a lymph node which has become infected, and this may be because of some primary pathology in the oral cavity. So that can be an infective pathology, or it can be a neoplastic pathology. In the history, there is a brief history of some oral ulcer which was biopsied, but it was found to be innocuous and it was not related to malignancy. So now the problem with us is how to make a diagnosis in this case and how to go forward. So the one thing is sure that this is an abscess presently which needs to be aspirated or drained. So the first thing we like to do is put a needle and aspirate see the pus, color of the pus, and send the pus for culture and sensitivity. Then we have to take a deeper tissue, and we take that tissue which is solid in this area and we send for histopathology. So that tissue will tell us whether it is simply infective pathology or it is a neoplastic pathology. So accordingly we will further evaluate the patient. Presently we will just do an aspiration, anti-gravity, and we take a tissue for biopsy, and then put the patient on antibiotics for 2 weeks and wait for the report of the histopathology. Once the histopathology report is available, accordingly, if it is simple abscess, antibiotic would be sufficient and some proper drainage would be done. But if it is malignancy, we will have to see what is the site. Most likely it may be the tongue or the oral cavity, and that needs to be treated accordingly. Thank you very much.